Thank you and welcome. This is obviously the first of these that we have ever done, and if it works out and people like it, we will try to do a few more in the coming weeks. I do think it's important to keep people seeing each other and engaged in whatever way we can. I was just saying at just a few minutes ago how surprisingly satisfying it's been to visit with people online. My own office has kind of a Google Meet that's just on constantly during the day, even though we're all on mute and just staring at our desks, but it's nice to see each other's faces. So it's nice to see all of you too. So we've got Councilmember Mark Levine with us this evening, and then we're also going to have Councilmember Carlina Rivera join us. So that's hopefully we'll get a lot of good New York City information. Let's just dive right in. And Mark, I just wanted to ask you before anything else, how are you feeling? How are you recovering? I know you were sick last week.
Thank you. Well, thank you, Jeremy and Lee and Caroline. And thanks to all the Grand Street Dems. I'm really happy to have a chance to speak to you. I'm doing much better. I was down for the count about 3 or 4 days last week, but I'm very lucky. I didn't need medical care. I've started to improve after about day 3, and I'm at about 90–95% at this point. And you know, this will be the experience of most of you who have coronavirus symptoms. Thank God, approximately 80% of people will be able to heal on their own. It won't be easy. That includes symptoms that range from something not much more than a cold to something comparable to pneumonia. But that is a distinct experience from those who really are in far worse shape and require hospitalization. This was a tough day for the city. We lost 188 New Yorkers today, or just in the last 24 hours. We've got a total of tragic 1,562 fatalities so far because of this virus. I think probably many of you know multiple people who have succumbed to this horrible disease, and to say nothing of the approximately 9,000 who are hospitalized. It's taking an enormous toll. This has been the worst week so far, but there are faint signs that some of the shutdown measures we put in place over the prior 3 weeks approximately are starting to yield some benefits. Really, there's about a 14-day delay before you start to see reduction in sickness, and we're not quite there yet for the most important shutdown we did, which was non-essential businesses, which was about 10 days ago. But there does appear to be a slowing in the growth rate of new hospitalizations, and we're very encouraged by that. I say only slowing in the growth rate. The numbers are still going up. There are still more people being admitted to hospitals every day than are being discharged, and that will continue. We're in a place now where the models are not exactly agreeing with each other, partly because people are still guessing on how much benefit we're getting from the social distancing, partly because our data out of hospitals is not perfect. But all of them agree that April is going to be really tough, and that May might be a little bit better, but will still be tough. And they really don't project significant turnaround until June. And that even that period will be something far short of normal. Perhaps we can reopen much of the economy, but that too will be a period in which we'll have to be on guard and take a number of extraordinary measures, and I can talk about that. But today, in our hospitals, there's not one hospital in New York City that is anything short of maxed out. They're all beyond maxed out. They're all serving patients beyond what they've done at any point in recent history. There are no more open beds in New York City hospitals. There are no more open respirators in New York City hospitals. The staff are being pushed extremely hard, 12-hour shifts, 14-hour shifts, day after day after day. Human beings who are experiencing the difficult conditions of the patients and the number that are dying. Talked to a number of doctors who have served in war zones who describe this as comparable. It's really tough out there, but you know, it's not the same everywhere. We are learning that this disease is hitting low-income neighborhoods harder than the rest of the city. We're seeing it in places like Corona, Queens, and Elmhurst in the South Bronx, and unfortunately also very much northern Manhattan, my neck of the woods. There may be pockets of downtown and LES as well. And it's because people who are living in crowded housing conditions, it's because low-income people are more likely to need to telecommute and putting themselves, or excuse me, low-income people are less likely to be able to telecommute and therefore are at risk, and that they've had a lower base of healthcare as well. This pandemic is both reflecting and exacerbating those inequalities. But I do want to say a word or two about what it means for all of you, for all of us, that we have a hospital system that is overrun at this point. It's going to have to change how all of us interact with healthcare. We have to preserve every element of the healthcare system for people who are the most sick, people who really are facing life-threatening circumstances. And so that means that if you are experiencing what are considered mild coronavirus symptoms, and these might not sound like mild, but really it's high fever. For adults, high fever is not easy, it's not fun, but quite common to have fevers of 102 or above, and dry cough, that you actually don't need medical care if you're otherwise healthy. Your advice will be to rest at home, to hydrate, to take medication for the fever and the cough, over-the-counter medication, and to keep a phone handy to call if you don't get better after 3 or 4 days, call a doc, or if your situation worsens, perhaps you're having shortness of breath, then you would call a doctor. But you don't need to go into an ER at that point. You don't need to call 911. In fact, if you show up in the ER, you'll probably sit there for several hours and be told to go home. It is important that you call unless you're really in an emergency situation. Now, some of you might be thinking, well, what about low-income person, someone who doesn't have insurance, someone who's undocumented, they don't have a primary care doctor to call? Well, the city's 311 system is set up now to transfer callers to the COVID hotline, which has 750 clinicians staffing that are ready to answer questions. They're multilingual, and they will bring you in for treatment in a public hospital if needed, regardless of ability to pay or insurance status or immigration status. So that's a really important message. If people are not in an emergency situation, but are not getting better or have worsening conditions, they need to call a doc or call 311. Some of you have probably heard a lot of ambulances and sirens outside. It's not just your imagination. We have more ambulance runs in New York City than any time since the days right after 9/11. 7,000 now a day. It's taxing the EMS system, and probably 2,000 of those calls are being made by people who shouldn't call 911 because their conditions are short of a true emergency. True emergency in the context of coronavirus would be difficulty breathing, chest pains, disorientation. And I guess the last thing I'll say on the healthcare front, and then I'll turn it over to you, Jeremy, is the big picture here is we have to turn our entire hospital system into a giant ICU. And that means that we need somewhere for patients who don't need acute care anymore, because the hospitals are overflowing. They're admitting and admitting and admitting more, and they can't discharge because there's patients who are coming out of ICU and they can't go home because they might still need oxygen or nursing care. We need somewhere to send them. So I have been loudly calling for the USNS Comfort and the Army Field Hospital at Javits Center to change their plan. Their plan has been to not accept coronavirus patients. I don't know if you know that. Only to accept non-coronavirus patients. That is not going to work. We need them. We need them to take those patients who are coming out of ICU who still need care. Late breaking news today, in the last hour or two, it appears that Javits is now going to accept coronavirus patients, not yet on the comfort. I think eventually reality will set in and they'll need to as well. I mean, my God, everyone coming into hospitals has coronavirus. Car crash victims are getting chest x-rays and they're showing signs of coronavirus. So that's why that ship is mostly empty right now. But maybe we'll talk about this as well, but there's other facilities from hotels to community healthcare clinics to college dorms, which are going to have to be brought into service to relieve hospitals of those patients which are convalescing, those patients which can't go home, those patients which don't have a home to go to, maybe because they're in homeless shelters or live in group homes and it would not be safe to send them. So this is a big public policy goal that I'll be talking about a lot in the days ahead. And I'm going to pause there and turn it back to you, Jeremy, and any questions that you all have.
Well, let me ask a couple, and maybe we can also bring Councilmember Rivera into this now.
Wonderful. Let me just say how happy I am that Carlina's on. She is my partner in all things health, and she has been amazing in this crisis, as she always is. So shout out to you, Councilmember.
And maybe I can let me then ask sort of just a follow up to these questions about Javits and the naval ship Comfort. Who then is responsible for making these decisions about how those facilities are used? Who's responsible for making decisions?
Department of Defense. That's the Department of Defense.
And that's true
for
the
Navy
also?
Yes, that's the U.S. Army Corps of Engineers. They're writing the rules, and they have been concerned that their staff would be exposed if they had coronavirus patients. But look, hospital staff are at risk, and we're doing what we can to protect them with, all the personal protective equipment. Honestly, Department of Defense has more personal protective equipment than our hospitals do, and so they have to take those measures. But look, this is the equivalent of wartime, folks, and we need everybody on the field, and that includes, I would think, first and foremost, naval personnel and the U.S. Army Corps. So I'm really relieved that it appears Javits is going to start taking some coronavirus patients. That's really a game change. And I'm hoping that the USNS Comfort does eventually as well too.
So then when you talk about possibly bringing hotels online for some kind of care or other facilities in the city, I know my friend Tommy Loeb here has suggested Basketball City, which is in our neighborhood, which is a nice big open space. Is there, and Carlina, maybe you can answer this, is there what role does the city play in creating those kinds of additional spaces that are going to get to be used?
I'm happy to let Carlina jump in, or happy to take a stab.
Carlina, do you want to answer that?
Sure. So hi, everyone. Good to see you. I have taken every single suggestion and recommendation that has come from you all and forwarded to the city. Right now, there is the headquarters, the Office of Emergency Management in downtown Brooklyn. That's where they take kind of larger donations. That's where they have representatives showing up every single day. And they're the ones looking at some of these spaces, whether they're viable, and also working with multiple agencies, which I think has been a little bit of a challenge, and Mark understands this, is that there's a Department of Health and Mental Hygiene, there's the State Department of Health, there is Health and Hospitals, and then there is the Greater New York Hospital Association, which is technically the umbrella over every hospital in New York. And so we are trying to look, we are suggesting spaces. They've actually been negotiating hotel spaces for weeks. And so everything has been a little bit slow to come to fruition, but we have recommended a few spaces that may or may not be used. I think what we're gonna see in the next couple weeks is that maybe we're not using like the gym at the Boys and Girls Republic on East 6th Street for beds, but it could at some point maybe become a pantry. I think there's going to be a lot of issues that you see where we're going to have to repurpose space to serve different purposes. Of course, always hitting what I think are the essentials, which is food, housing, education, and healthcare. So I think all those suggestions are great. I take all of them, I send them to the city, I send them to the mayor's office. We also forward them to the governor because if you haven't noticed, I think the governor's been a little, on some decisions, been a little bit quicker to respond. And I think, thank God. So we're trying to all work as one. It's been a little bit difficult in terms of transparency, but we are still taking recommendations as to big spaces. And I took Tommy Loeb's Basketball City and I sent it right away.
But does that sound like those kinds of decisions will ultimately be made by the state, by the governor, by the state health department? I'm trying to figure out who actually gets to turn the lights on somewhere and move beds in.
No, it's a valid question, and I think that's something that Mark and I have been calling for a while. I know that I've been calling for one system. I don't think that they have been working together probably in the most efficient way possible, but perfectly understandable. It's a very untenable situation. It's hard to manage. The State Department of Health is actually a very, very big player in this. And I mean, Mark has a great relationship with the Department of Health. So maybe Mark, you could speak a little bit to kind of what you feel the Department of Health's major role in kind of this whole crisis has been, besides like getting us information, which has been important.
Yeah, I have to say, we have the best public health department in the world. Some of the folks who are leading the fight, for all of you that you don't know because they're not in the news, have become some of my heroes. So I think you can sleep a little bit better at night knowing the caliber of decision makers and experts over there. They are working to bring online all sorts of city-owned space, and the state is using state facilities as well. Actually, Javits, of course, is a state facility. I don't know, sometimes it feels like there's a little bit of rivalry between city and state, which I think is what Carlina is nicely referring to. Look, space is not going to be the hardest problem. We got probably 100,000 empty hotel rooms. We got empty college dorms. The problem is who's going to staff those spaces. And actually, the mayor put out a call today for U.S. military to send in 1,000 nurses, 150 docs, 300 respiratory techs, because they can move people around quickly. And this is going to be a much bigger problem. It's a very technical, specialized work to support someone who's got a respiratory disease. And sure, you can activate a hotel or a college dorm, but the question of staffing is going to be much, much tougher. And the health department, the mayor are, I think, really prioritizing that. I think they're seeing it perhaps as even a more difficult challenge right now than supplies and equipment. But that war continues as well. I think we're now 6 days away from running out of ventilators, and fewer days buffer on supplies like masks.
Yeah, I was going to ask about that. Mark, you tweeted 2 weeks ago. You said this is what New York City needs by early April: 3 million N95 masks, 50 million surgical masks, 15,000 ventilators, 25 million each of surgical gowns, coveralls, gloves, face masks. Are those numbers still correct? Are we anywhere close to getting what we need?
Sadly, no. The federal government has delivered us less than 10% of what we're asking for. This is just outrageous. The way that the federal government has completely reneged on what a national government should do in the equivalent of a wartime crisis. We needed them months ago to ramp up production, force manufacturers to retool and begin producing ventilators, respirators, gowns, gloves, face shields, all of it. And instead, we have had the equivalent of the Hunger Games, where states have had to go out and bid on the same piece of equipment and the same batches of supplies, bidding up the prices, competing against each other. It's outrageous and it's unsustainable. And I'm sorry to say, and you won't be shocked to hear as a Democratic club, that the way the federal government has doled out its stockpile reflects a Trumpian view of the country. The state of Florida, which has been irresponsible in its refusal to implement social distancing until today. Today, they finally, or actually, I think it took into effect at midnight last night. They put into place a shutdowning non-essential businesses. They put out a request for supplies. They get 100% from the feds. Then a week later, they got the same amount again at 200%, and there's a third shipment coming. So Florida is now going to be at 300% of requested. And by my estimate, we're at 10% requested. We are the Wuhan of America. We are. And you know, China saved Wuhan because they sent in 40,000 doctors from other parts of that country. We're still waiting for our 40,000 doctors.
Is there anything to do to get this to happen? Carlina, I think has an
Carlina,
answer.
please, yeah.
No, I think that I know that sometimes you hear some of this news and it can be frustrating. It can certainly also feel a little bit debilitating, like what can you do? But I do not want you to dismiss the power of advocacy. It is with advocacy that we were able to push cable companies to reverse their policy of granting families free internet if they had outstanding bills. Previously, cable companies were not allowing students with outstanding bills access 60 days of free internet. Because of advocacy, those companies reversed their position. There was a guideline at some of our hospitals that said there could be no familial support in the labor and delivery rooms for pregnant people. On always understanding that we have to keep patients and staff safe, there were alternatives to that, and there was a general guideline that was issued that said they were going to allow familial support with very, very, very strict protocols. So that all came out of advocacy. So what we have to keep doing is ringing the alarm, and Mark has been doing this on Twitter a lot, is just saying what we need over and over and over again. The decision to work as one hospital system in the last couple days was so ridiculously overdue. There is a Greater New York Hospital Association representative inside of the OEM headquarters every single day. Why did Ken Rasky, who heads the Greater New York Hospital Association, just show up to the dais with Cuomo the other day? We have to be sharing supplies. We have to be making sure we're taking care of patient transfers in a responsible way, because our public hospital system was absolutely at capacity, and they were in the very neighborhoods that we could have projected that had health stats which were unhealthy, where there were immigrant communities, where there were people who spoke English as a second language. And so not getting those resources to the places that need it most, that to me was the most troubling in terms of how long it took us to respond. So I would say continue to reach out to your elected officials. I think that the state budget, unfortunately, I know you all did a ton of advocacy around it in terms of, we have very good representatives here downtown, so we're very lucky, but reaching out and letting people know about the Medicaid cuts that were going to be included in the budget. That's just something that we have to keep talking about. It doesn't look good. The budget looks really, really bad for Medicaid and funds to poor people. But I want you all to know that having you all back us up, like our constituencies, is really, really important. So we have to just keep saying what we need. And Mark is right. This is a political device that is being used to punish certain communities. And unfortunately, you know, New York City, we're struggling. We're struggling, but please remain hopeful, because we are a very, very strong, resilient city, and we have some incredible people leading the way. Dr. Katz, who's the president and CEO of the public hospital system, I talk to him all the time. I try not to bother him too much, because please understand, as Mark mentioned, the #1 issue is personnel. So I just try to ask the questions that I think people really need to know. Elmhurst Hospital, Queens Hospital, Lincoln Hospital, these communities, they're all very, very hard hit. And what this has done is just expose the inequities that many of us know already existed in some of these places. So, and again, this also goes to, you can kind of see this political device used in other parts of the budget. When they passed the stimulus package, some of those unemployment insurance benefits, or even some of the programs out of the Small Business Administration on the federal level, undocumented people or people who do not have a social security number do not have access to those programs. So it is somewhat intentional clearly on how they leave people out. So we just have to keep asking, and we have to keep demanding, and we certainly have to stay united on one message.
Let me let me ask a slightly different question, which has to do with all of our lives and how we're dealing with staying at home, working at home, trying not to leave the apartment. And it has to do with open space and the ways in which I hope we will continue to be allowed to use open space responsibly. And I'm just curious if you have an idea of where the city's headed on this. I know Chicago, when they announced their lockdown last week, it included a complete closure of public parks. And at least for us down here on Grand Street, we're very lucky to have some space available to us. I see my friend Michael Marino sitting in front of a nice picture of the magnolias from Curler's Hook. There's space there. We've got a quick walk over to East River Park, and aside from shutting down basketball games, which I completely understand, do you think that we will continue to have access to parks for walks and bicycle rides to be able to get fresh air? And two, do you think there's any chance that for neighborhoods that don't have access like we have right now, if there will be some more streets shut down to cars so that people have a responsible place to spend time outside? Or do you think inviting people outside in that way is too dangerous, and that we can't be trusted to keep ourselves from being social creatures?
I'm happy to jump in on that. There's not currently consideration of closing parks beyond the playgrounds. That was a move made yesterday by the governor. It was difficult but necessary. There was just too much crowding in those playgrounds. Parents and kids tightly together, touching contaminated surfaces. Kids, thank God, don't generally get this disease, but they can carry it. But one thing we understand about coronavirus is that if you're healthy in general, you have much better odds in facing it. And so we actually need to encourage people to continue to exercise, also eat healthy and sleep. I'm not saying I'm a model in any of that, but solo exercise outside is actually really important, I think, as part of our strategy here. I said the word solo. And so no more volleyball games, no more basketball games, no soccer, no socializing, picnics, barbecues, none of that. And to be honest, there is still, I think, too much congregating outside in some parts of the city, and it's dangerous. But I think because of the need to promote exercise, parks will remain open. I do want to mention something important about being outside that some of you might have heard today, which is the city's health department now is changing its recommendation and is recommending that everybody wear face coverings when they go outside. Now, that's been talked about a lot for a couple of weeks, but the official recommendation from the health department is new this afternoon, and it was sparked by new research which shows that people can be asymptomatic and therefore carrying the virus for longer than we realized before they show symptoms. And so the concern is that people who feel normal would be outside and wouldn't be covering their mouths, but might actually be contagious. So the health department's using the word face covering, not mask, because they don't want us all hoarding the kinds of masks that healthcare workers and first responders need, the N95 and the surgical masks. But you might be surprised that any kind of face covering gives you most of the benefit of a surgical mask, whether that is a scarf, a bandana. And for any of you who are handy and can sew, using an old cotton t-shirt, as long as it's clean, actually is considered to be quite effective. And there are all sorts of patterns online that you can use to make your own masks, and they're surprisingly effective. So this is kind of a major change, almost in the culture of the city, which may be long lasting. But I do want to make folks aware of this. If you see more folks covering their face, you'll know why, and I hope you will as well.
Carlina, do you agree about keeping parks open? And do you know of any effort to? I know the city opened up some very small stretches of streets. I mean, it was comically small stretches of streets, but I didn't know if that was. I didn't know if that was leading to something, or if that was the end of the experiment.
Well, you all get the inside information, I guess. Mark and I called for the closing of playgrounds a long time ago. Mark is the former chair of the Parks Committee. He knows better than anyone how understaffed and under-resourced that agency is just generally. It was just not sustainable to keep them open for a number of reasons, besides that it was the safest decision in terms of public health. Keeping the parks open, that's great. You can jog 6 feet away from somebody. I mean, I've certainly taken a run and taken a bike ride all over the neighborhood by myself or with Jamie, my husband, who you all know is very wonderful. And I think it was the right thing to do. The street closures, if you all noticed in Manhattan, there was a street closure in my district. In an attempt to move this closure along as quickly as possible, I said I am willing to close streets in my district. I gave a number of locations. What happened? They closed 6 blocks on Park Avenue South. So I just want you to know that we are really trying. I spent a lot of time giving them suggestions on where we could close streets, so that way people feel like they can go. I mean, I saw on Avenue A, a son and his dad, they were just tossing the football. And I thought this could happen in the middle of a closed street. By the way, I'm a New York City kid. My recess was in the street with the barricade. That's just our experiences growing up here. So, you know, I guess I agree with Councilmember Levine. You know, you have to try to get outside, but do it safely. And we can certainly be a little bit more creative. I just think right now we're in such a high response mode because, you know, the numbers are really, really troubling, that the mayor is trying to be very careful and respond to different communities. But at this point, this is the crisis we're in. This is why, you know, Javits has to take patience. This is why the Comfort has to take patience. This is why we have to close a lot of things down, and it's going to hurt us economically very, very badly. But it's what we have to do because, you know, everyone's life is valuable.
I've got a question from Melissa Schiffman. Actually, I don't know if it was a question or just something you wanted to let us know. But Melissa, do you want to chime in?
Sorry, both. I guess it's what I'm going to read to you and then a plea. So my uncle is a doctor and he's working in one of the Queens hospitals. And he texted me today, just kind of letting me know how it is. And I know that Carlina, you and Mark probably know all this, but I'm going to just repeat it anyway, because obviously it's very personal, and thank you for being here tonight. So he was saying that if you're in an operating room, you'll get things like a cap for your hair and shoe covers in addition to gowns and gloves. But if you're on the floor or in clinic, you can't get any of those. You can get a mask, an N95 mask, only if you go into a droplet precaution room, but not for anything else. So he's been reusing his and rotating them every 3 days and spraying them, which is normally not acceptable at all, obviously. Gowns over clothes are only available for droplet room or for difficult to treat infections and nowhere else. Even in the ER, by the time you find one, you've come into contact with 50 patients. Nothing is available right now. And then he goes on to say that if a healthcare worker shows symptoms, it used to be probably like 3 weeks ago, that you would get tested and quarantined for 14 days. Now you go home and stay there until you have no fever for 3 days without Tylenol, and you don't get tested. So obviously hearing that is very upsetting. And I guess my question is, what are we doing about this? I mean, talking about wearing masks, and I heard Trump today talk about everyone's going to be wearing masks, but if our healthcare workers can't even get masks, and they're reusing their masks, and which is so dangerous. What can we do? Or what can you do?
Oh my goodness, Melissa, it was very, very hard to hear. I have to admit, it's not the first time I've heard reports like that. I know Carlina has too, and probably all of us have. I mean, these healthcare workers are going through something that you wouldn't want anyone to have to experience. It is equivalent to a war zone. I've talked to people who are working in the Ebola crisis in parts of Africa who describe this as worse. It's so hard because normally with patients, there's things you can do to save them, and then here you kind of just have to hope that the patient's immune system takes over. Obviously, we owe it to these heroes to protect them, to provide them the gear they need to be safe. And I really think that when the history of this pandemic is written, the failure that's gotten most of the coverage, which is the lack of national testing capacity, is going to be considered the second biggest scandal. The biggest scandal is going to be our failure to mobilize production of supplies like personal protective equipment and ventilators in time to get it to people. And so, right now the hospitals are running on just a couple days supply of all those things, but that is under a condition in which they are telling staff to reuse material, which is not fair and not the way it should be done. And until we can start to get more of this supply sent to us from the federal government, it's not going to change. And so, getting back to Carlina's very important point, man, we got to use our voices to scream for this. We have to scream for the federal government to send us the millions of pieces of protective equipment that we need for our nurses, for our doctors, for all the staff in the hospitals, for EMS workers and cops and firefighters and supermarket workers and laundromat workers and pharmacy workers. There are shortages in every one of those arenas. And we're now forced to ration. And it's scary, and it's not fair to the people putting themselves at risk for us. So we got to keep fighting on this, and thank you for sharing that very heartbreaking but important story, Melissa.
And can you tell them, your family member, thank you? I mean, this is something that we have, that has frustrated me personally, is that I think, I watch the Cuomo show every day, and I think it's valuable information, but I do not think that the comments that are made by some of our city and state officials reflect the reality of our frontline staff. And that, to me, has been the worst part of this, is that we would hear many times that we had adequate supplies, adequate ventilators. Yes, there was a list of things that we needed, but that word was, in my opinion, my humble opinion, used way too frequently. There isn't enough supplies. There were some hospitals that were trying to, not H&H, not Health and Hospitals, according to Dr. Katz, but some who didn't want their healthcare workers to speak out, and were trying to basically implement a gag order. And I think when you saw what happened in Elmhurst Hospital, it is because of people like your uncle. It is because of doctors and their Instagram stories that a lot of this really got brought out to light. And that's what ultimately helped get some of those supplies to those spaces. This is not a perfect system. Last Monday, I was on the phone with the CEO of the Navy Yard when he said that they were pivoting to local manufacturing. That's a really inspiring story, because those companies are probably at the brink of bankruptcy. They're taking great risks, but they know that this is what we had to do. Why are we waiting so long for a federal intervention? I can't answer that, but that is what New York does. We do local support systems, and I was really proud of that story and of those people and of those companies. But your family shouldn't have to go through that, and I'm sorry, and we're gonna keep fighting.
Thank you for everything you said, Carlina. I totally second it. I just want to mention something that Carlina and I are doing together under the leadership of our colleague Brad Lander. which is we want stronger legislation to protect whistleblowers in hospitals. We have heard in the press already of 2 cases of hero doctors who have spoken out about the kind of conditions that we're describing, the lack of protective gear, and have been fired. That is outrageous. We wouldn't even know about some of these conditions if these heroes hadn't dared to speak out. So Carlina and I, again, credit to Councilmember Lander, who's leading on this, we're co-lead sponsors on this legislation that will make it illegal for hospitals to fire any whistleblowers in this crisis or beyond.
Hey, Tommy, you had a question about the aid workers in Central Park.
Yes, thank you. And thank you, Carlina, for recommending Basketball City. I spent part of my career working with Ruth Messenger, the former Manhattan Borough President at American Jewish World Service. And I was kind of shocked. They were an international development and relief organization. And I had some experience in the background of Samaritan's Purse. And I was kind of shocked when I saw the city invited them to a very prominent position in Central Park, where they are now, as you know, their background is they're anti-gay, anti-Muslim, racist, and have a known record of that. A simple Google search would have found that out. But here they are using a very prominent spot in Central Park. Now, if you go to their website, you'll see they're raising lots of money now off of this spot in Central Park. And if you look, they're using a very clever trick that's used in the fundraising sometimes. They say that all funds raised will go to further their mission throughout the world, meaning they're raising money on this nonsense going on in Central Park, anti-gay, anti-Muslim, and then going to use that to propagate their work throughout the world. It's embarrassing. I understand the need for some of the ventilators and some of the equipment they have, but I hope the city is really looking very closely at what they're doing. And I'm concerned about them using this as a fundraising platform for the rest of their work.
So I guess the question is who is responsible? Is there any sort of vetting?
I certainly share every one of those concerns that you articulated, Tommy. This was the Mount Sinai Hospital put out a call for help, and these are the only folks who answered. And we have gotten assurances from them that they will, from Mount Sinai, that there'll be no proselytizing there, that the chaplains will not be approaching anyone unsolicited, and of course, anyone who doesn't want to be served there won't have to be. It's still profoundly disturbing that they're here in our city, especially in the sacred space of Central Park. And I've spoken to Speaker Corey Johnson about this, who's extremely upset. And he and everybody are just watching this like a hawk and making sure that that every single patient is given fair and dignified care, no matter who they are.
And then finally, as we're hitting 8 o'clock, I wanted to ask you guys and maybe other people who are on the call, what can people do who are looking for ways to responsibly volunteer in the neighborhood? Carlina, I think your office has been putting together some connections along that route, but I not just a list of names, although that's helpful, but I'm also really curious how we manage things like food delivery to neighbors through local service organizations and maintain a healthy level of protection for ourselves and the people we're delivering food to, and and where that stuff is getting packaged together. You know, in the normal course of business, we have health codes for restaurants, and I'm kind of curious if there's anything like that now for the various local relief organizations that are coming together to make sure that when I leave my apartment to go do something that I feel is going to be helpful, that I'm protecting myself, and that I'm also making sure that I'm not getting somebody else in trouble. Carlina, can you speak to that a little bit?
Sure. So we have a volunteer infrastructure set up in my office. We're proactively calling people that we know that are elderly, that may have physical limitations. We're trying to be very careful on how much information, of course, that we give volunteers. We have a script, we have a resource page. Most people are calling about food, and then also just general information. So the food is the most difficult piece, because what Councilmember Levine mentioned earlier about competing on the open market for supplies. By the way, this is also happening to our food pantries and distribution networks. You know, they are out there competing against larger giants like Fresh Direct and Walmart to pay for a lot of the things that they distribute to their more local pantries. So how do you stay safe is the better question. One is you can make calls from the comfort of your own home, and we will give you everything you need to call people. We have made hundreds, well, just this week, I mean, we've made thousands of calls to people just using my team, which is an amazing staff of 6, and volunteers. We've called a lot of people. For example, tomorrow we have some food coming in that we want to distribute to our public housing residents, specifically in a senior building. And then I also have potentially Vision Urbana, who many of you are very familiar with, and Eric Diaz, and he's been doing home deliveries. But right now, his infrastructure has not proven to be sustainable, because we want to make sure that he has the supplies to make sure that volunteers are safe as well. So you need, if you don't feel well, clearly don't do anything. But you need a mask, you need gloves, and you certainly need to know exactly what you're doing to keep yourself and that person safe. So we don't really engage in any activities that we don't feel pretty confident that someone is going to be safe. In terms of how we deliver food with our TA leaders in public housing, we typically just have volunteers bring boxes to that TA leader in that room and prepare them. It takes a lot of work. It has taken a lot of work, and DFTA, which is the Department for the Aging, has really transitioned all of their grab and go meals at their senior centers also to delivery. That is not a perfect system right now because it just started on Monday, so they kind of need some time. So I guess the answer is yes, we want to make sure that all volunteers feel safe, that you have gloves, that you have a mask, that you aren't putting yourself in any situation where you come into, you know, closer than 6 feet with anyone. But we have options, and we can certainly use your help. So you go to district2@council.nyc.gov. I'll put it in the chat box.
Yeah, Carlina, I know you've got a COVID-19 update page on your council website, and
Yes,
there are a couple of links there.
Again today. So we're trying to just get real straight up information. We don't want you to, the graphs, the numbers, they get crazy, they get different, they're overwhelming. We really try to keep it very clean cut. I'm very proud of the information that we provide. If you want to subscribe to my newsletter, we not only provide medical hospital information, but, you know, virtual tours, fitness classes, to do things inside the home with your kids. So we really try to give you a diversity of things to get through this. We also have hotlines for people who need mental health support, veterans, seniors, children, survivors of domestic violence. This is, again, an unprecedented thing, and we're really trying to cover everything. So I'm going to put in the chat box the COVID website, and then of course the email if you'd like to volunteer. No pressure. I just want you all to stay safe, because you are very, very important to this community, and I just want to thank you.
And I'll definitely include that in the follow-up email tomorrow to the group. So thank you for that. And maybe also I can get Lee and Carolyn, if she's still there, to hop in. I know you guys have been working with UJC down here to deliver some food. And I know there's an effort going on to make sure that some of those folks have Passover meals next week. Carolyn, are you there? Do you want to tell us a little bit about that?
Can you hear me?
Yes.
Sorry, guys. I got sick today, so I'm not on video because I'm sort of I'm in my dark bedroom. But so the UJC, which is the lunch club, is headquartered on Willett Street, around the corner from Abrams Art Center. You know, normally people come in for their lunches, and they've been doing deliveries. And for Passover, they're doing a special delivery to all the tenants in the co-ops, and we have had a lot of success with co-op volunteers, and it's contactless. These lunches are bagged in plastic bags. You have a list, you drop it on their doorknob, and you knock loudly and just kind of announce UJC Lunch Club, and you walk away. You're not supposed to wait. You're not supposed to face people. So tomorrow, at least for Seward, the clients who live in Seward, tomorrow is going to be the big Passover drop, and it's more, each client is getting 3 bags because it's, you know, it's all the supplies they need. We have already a good crew of volunteers. We could use a few more, and so if anyone's around, it doesn't take long. You just need a couple fresh direct bags, which you probably have lying around, or maybe a wheelie cart, because these are going to be bigger deliveries tomorrow. We meet in front of Apple Bank because they want us to arrive basically together. We meet there at 5 to noon, 11:55, and just walk half a block over. And then you get your list, and everyone stands very far apart from each other. So I'm going to make a quick plea. I won't be doing a delivery tomorrow, but Jeremy has the link to the Google sign-up sheet. And if anyone has like 45 minutes free tomorrow around noon, it would be, you know, it's a great way to just, you know, do one sort of tangible thing that is really helpful to some of our neighbors. And I know Lee's been coordinating for East River. They want everything delivered by Tuesday, April 7th. Passover starts Wednesday night, right? I think it's Wednesday night, Thursday. So anyway, Jeremy has the link for the Google sign up. And if you just decide to come, just show up in front of Apple Bank on Grand and Pitt at 11:55 with your bags or a granny cart.
And Lee, what's the situation in East River, Hillman?
So Hillman does have a small core of volunteers who have been helping out. They are dwindling. Some of them have gotten ill. East River is in dire need of as many folks as possible. You don't have to live in East River or Hillman or even Seward, although it's preferable. But if anybody is able to help out, they need that help. And as Carolyn mentioned, it'll be you know, bags, and I think there may be a box or two. So any assistance that anybody in the community can give to help these folks who are in dire need is greatly appreciated.
I think Carolyn's instructions about meeting at the Apple Bank, that was just for the Seward co-op group. Is there anything similar set up for East River and Hillman, or is there a contact for that?
There is a contact. If you're interested in volunteering, we can put you in touch with Dina at the United Jewish Council. I haven't heard of a time or meetup yet. They don't need to do it all in one day. They are not able to give food on Saturday or Sunday, obviously, but as Carolyn mentioned, it also has to be done. They need to do this by Tuesday. So if anybody's able to even stop in tomorrow, Friday, as well as Monday and Tuesday.
Okay, well,
And if you're coming from one of the other co-ops and you want to meet us in front of Apple Bank, like, just so you know where you're going and what you're doing, come along. You know, again, it's half a block away. You probably walked past this building a million times. Oh, and they want everyone to wear a mask and gloves and carry hand sanitizer. If you live in Seward, our management office will give you mask and gloves, and they have giant vats of hand sanitizer. So if you have like a little squeeze bottle of Purell that's almost empty, come and refill it. They don't have like travel size bottles, but they just want you to, you know, be geared up.
And Jeremy, I'm so sorry to interrupt. I'm going to have to hop off. I just wanted to thank everyone.
That's great, Mark. Thank you. I think we're going to wrap up anyway. This was our allotted time, so this is a good time to thank you, and thank Councilmember Rivera for joining us. And thank everybody else. We had 30, 35 people here. I hope this was helpful. If you guys have any suggestions for how to do this better, please send them my way, and we'll try to have a few more of these during this time. So thank you all. Thanks very
Thank you.
much.
Stay safe, everyone.
Have a good night.
Thanks, Mark. Thanks, Carlina.
Yeah, thank you
Thanks,
so much.
everybody.